Hello, I'm Sheila Davies, Director of the Dare County Department of Health and Human Services. New cases of COVID-19 are growing rapidly in Dare County, as well as the state and nation. Since our last report on 12/22, we have seen an increase of 136 new COVID-19 cases. Of these 136 new cases, 117, or 86%, are symptomatic. 106, or 78%, acquired the virus by direct contact with an individual or individuals who tested positive for COVID-19. 21 of these cases are connected. We have seen a marked increase in the percent positivity rate. For the past week alone, the percent of positive tests to total tests for COVID-19 was 13.6%. We have also seen an increase in coworker to coworker spread of the virus, linked to staff gatherings and meetings. The total COVID-19 positive case count in Dare County is 1,560, of which there are 113 active cases among residents of Dare County. Of the 1,560 cases, 1,026 are residents and 534 are non-residents. Currently, 11 residents are hospitalized due to complications from COVID-19. The vast majority of new COVID-19 cases in Dare County are linked to direct contact between close friends, coworkers, and families. You can protect yourself and others and help reduce the spread of this virus by practicing the 3 W's. Wear a mask, wait 6 feet apart from others, and wash your hands frequently with soap and water or use hand sanitizer. Even though our close family, coworkers, and friends are the people we often feel most comfortable with and safest around, contact tracing is showing that the virus is spreading most between these individuals and not from the brief interactions at the grocery store or in retail or commercial settings. Whether visiting a neighbor or friend or at work, please be sure to wear a mask and maintain at least 6 feet of physical distance from individuals who you do not share a household with. Our department is continuing to vaccinate frontline healthcare workers whose duties put them at higher risk of exposure to COVID-19 or who are vital to the initial COVID-19 vaccine response. This is Priority Group 1A. We expect to remain in this prioritization group for approximately 2 more weeks. Information on the vaccination plan is rapidly evolving. The CDC has recently made changes to their published vaccine prioritization groups. However, Dare County is required to follow the direction of NCDHHS on the groups. If the state changes the prioritization groups for North Carolina, Dare County will follow those changes. Dare County is not permitted to locally change the prioritization groups. When registration opens for the general public according to the required prioritization groups, we will post that information on our vaccine webpage, which can be found at darenc.com/COVID vaccine. Please visit this site for the latest information on the COVID-19 vaccine or visit the NCDHHS website at covid19.ncdhhs.gov/vaccines. Each week, we review the 4 key metrics associated with disease investigation and surveillance. The metrics are number of tests, confirmed cases, positive test as a percent of total test, and COVID-like illness surveillance. This past week, there were 1,118 COVID-19 diagnostic tests performed in Dare County. This brings the total number of tests performed since early March to 25,346. There were 152 positive cases between December 21st and December 27th. The percent of positive tests to overall tests in Dare County since we started testing in early March increased to 6.04%. The percent of positive tests to total tests for the past week alone was 13.6%. Syndromic surveillance of the emergency department and urgent care centers showed an increase in individuals presenting with COVID-like symptoms in the early part of the week. These graphs can be found on the Dare County website at darenc.com/COVID19. We encourage you to stay informed by visiting darenc.com/COVID19 or by visiting the CDC or NCDHHS websites. If you have specific needs or questions, you may also call the Dare County COVID-19 Call Center, open Monday through Friday from 8:30 a.m. to 5 p.m. at 252-475-5008. Thank you.